I'm the Director of Healthcare Services for the Clinton County Health Department. Thank you for tuning in to our message today. I'm going to start with a few points. We have a few questions that came in ahead of time and just summarize those, and then we'll take additional questions that come in as we're talking. I want to just acknowledge how difficult this pandemic continues to be, and there are so many unknowns, but thank you all for doing your part and continuing to be kind and supportive to each other. It's making a difference. We continue to work tirelessly day in, day out, nights, weekends, to do everything that we can to identify cases and suppress the spread of this virus. Our work is not flagging. We're still here all the time working for you guys, and I just want to say this partnership between the health department and the public and all of you doing everything you need to do to keep each other safe, I think is making all of the difference. We do want to ask that you just keep it up, keep being a role model, keep wearing your masks in public, maintain the physical distancing, keep washing your hands, avoid the large crowds. These things make a difference, and they can be hard and tiresome to adhere to, but they are what we know works, and we have to keep doing it. There are a few questions that came in on yoga studios and gyms. I'll just start with those. The State Department of Health and the Governor's Office make the determinations about what entities can be open and when. That's not made at a local level. At this time, my understanding is that some of these can be held outside safely, and that is happening, but I don't have the answer, unfortunately, to what is going to happen in the future. Again, those are not our decisions to make here. There was a question about when was the last COVID death in Clinton County, and just emphasizing the good news that as compared to the country, we're not seeing the same level of impact. I have to re-emphasize that's because all of you do what needs to happen in order to contain the spread of the virus, so thank you. There's a question about Cuomo stating that testing is available on demand in New York, and in Clinton County there is capacity for testing. Testing should start with your primary care doctor. If you don't have a primary care doctor and you need a test, CVPH is offering testing on Wednesdays and Thursdays at the Plaza location from noon to 2 p.m. Don't go there if you're symptomatic. If you have symptoms, give us a call and we'll talk you through what to do. Or call your healthcare provider preferably first if you have one, but if you don't have one, call us. We'll talk you through what to do if you have symptoms. That is a testing option. The local Hudson Headwaters offices and the local Wellnow does have testing capacity too. There was a question about why are inmates getting visits but not the elderly who need it more than ever, and I hear you on this one. I can't speak for DOCS. DOCS, the Department of Corrections, has their own policies. They make those in consultation with the New York State Department of Health, and I don't have a comment to make on that. I will say that the elderly population are so vulnerable to the virus and they're more likely to die, and that is the rationale behind continuing to not have the level of visitation that I know families would really like to see at this point. Hopefully that changes, but again, they need more protection than the rest of us, than an average person. This one, there's several questions in a paragraph, so I'm going to try to separate these out a little bit. One is, why is it that you do not do live updates? We actually are doing a live update. This is a live update. We paused for a period of time only because there seemed to be a decreasing level of interest, maybe. We'll continue to do these as needed and as we're available. We're still working hard, so the live updates are our way of communicating with you, but even when we're not doing them, we continue to do our work sort of behind the scenes.
Erin, we're going to pause for just a second because I think we're having a volume issue, and I don't know. I'm just going to move this a little bit closer. We'll just try. Okay. Okay, let's continue and we'll see. Yeah.
Okay. Hopefully you can hear me better. I don't have a loud voice. There was a question about how it is that we didn't necessarily see spikes in infection rates after a protest as opposed to a party, and that is because of how the virus is transmitted. When we did see the protesters here in Plattsburgh, they were very responsible. They wore masks, they did their best to maintain the physical distance, and at a party, typically people are not wearing masks, they're much closer to each other, and they are eating, they're drinking, they're talking. The likelihood of infection from that type of interaction is significantly higher. And that's why we are still emphasizing that it's best to avoid large gatherings. Even though gatherings of up to 50 people are permitted, that doesn't necessarily mean that it's really advisable or safe to have a gathering or be at a gathering of that size. There was a question about false positives. I know that was an article in the newspaper. Here at the health department, we do not make a determination about whether a lab result is a false positive. If we get a positive lab result, that result is treated as a true positive. We know that there's asymptomatic carriage of the virus. People cannot show symptoms and test positive and still spread it to other people. And so to be prudent, we have to treat every positive as if it's a true positive, whether the person who has that test result agrees with it or not. That's just the safest way for us to proceed. With the types of testing that we have available to us, it's actually far more likely that we would get a false negative, not a false positive. There was also a question about whether a person who gets a test and has a negative result can then resume normal activity. For example, if they're on quarantine, a negative result, or a positive result, but a negative result measures a point in time. Having a negative result today does not mean that you won't subsequently have enough virus in your system to test positive tomorrow. So that's the reason why you can't test out of quarantine. If you're exposed, you have up to 14 days to start developing symptoms. And the negative test on day 2 still means you have 12 more days in which to develop symptoms. The negative test doesn't mean you weren't infected, it just means there's not enough virus present in that exact moment to show up on the test. I also just want to mention, because we've had reports to us of people on quarantine in different households misunderstanding the nature of quarantine and spending time together. Quarantine does not mean you get to hang out with other people on quarantine. It means you need to avoid all people to the extent possible in case you become sick and develop symptoms, because another person on quarantine may not have been exposed to the same level that they would get sick, but you can subsequently infect them if you happen to have enough virus to become sick yourself. So quarantine means that you do not spend time with anybody and you avoid all people to the extent that you possibly can, regardless of their status of also being quarantined. And there was a question about the characteristics that we've been seeing, whether we're seeing trends in more young people being infected or sort of what the age demographics are. We're seeing a great amount of variability. For the month of July, it went from teenage years into the 80s, and there's not enough of a trend in any specific decade for us to be able to say that it's more one age group over another becoming infected. Anyone can become infected with this virus, unfortunately, so we all have to be careful. Those are all of the prepared comments that I have. I believe some additional ones have been coming in as I've been talking, so I'll just ask about any other questions.
We have one question currently on our Facebook Live. Is there a blood test now, or is it still a swab?
The blood test is the antibody test, and that does not determine current infection. It means you've been infected at some point in the past. It's not an exact date, it's sort of a ballpark depending on whether it's the IgM antibody or the IgG antibody that's positive. The IgM antibody indicates more recent infection, whereas the IgG indicates past infection further out than a few weeks. But they're not specific enough, it just indicates that a person was infected at some time. So what we are looking for is the PCR. That's the most reliable result. There's also antigen testing, which is the rapid testing, but that requires that the person be symptomatic when they're tested, and it's also recommended that a person subsequently be tested with a PCR test for confirmation. So the PCR test at this point is our gold standard for testing.
Our next question. Of the 10 active cases, can you speak to how many are related to each other or related to the party in Altona?
So we have 5 that are what we call epi-linked, and they're associated with each other at this time. And the other ones are a mixture of community acquired, community spread, where we don't know exactly where the person was exposed, and travel. We are seeing some people who traveled and came back, and during that quarantine period when we're observing them for symptoms, they did test positive, which is why we're continuing to recommend that everyone avoid travel. It's not safe to travel, unfortunately.
Has contact tracing determined where the virus came from to get to the party?
Unfortunately, no. We don't have what we call an index case or a single person who developed it before the others tested positive. So that could be because there was an asymptomatic person at the party who did not get tested who infected the others, which is why we always need to wear our masks and maintain that physical distance from each other.
What types of symptoms are you seeing or treating with those that are positive for the virus?
The symptoms continue to be primarily respiratory symptoms, although there are some others like the loss of sense and smell and some gastrointestinal symptoms that some people have. There's actually quite a wide array of possible symptoms, and also sequelae or resulting problems once someone is no longer considered infectious, but they still have ongoing issues where they don't feel well or they don't feel the same that they felt before the virus. There's a really broad range. At this time, there's no clearly definitive treatment. There are treatments available, none of them are guaranteed, and prevention remains the best approach to staying healthy.
At this time, that was our last question. If we want to give a quick minute here for anyone that is joining us live to ask us a question.
I will, in the meantime, take an opportunity just to speak about schools a little bit. Schools are working really hard on plans for reopening as safely as possible this fall. Their plans are due to the State Department of Education today, actually, and those will be reviewed at the state level, and feedback will be given to individual schools. But there are some principles that they're all adhering to. There's actually a very lengthy, I believe, 145-page guide that they all have to reference that was put out by the State Department of Education with consultation from the State Department of Health. And the basic concepts are that the most vulnerable individuals need to be protected as much as possible. Those with underlying health conditions should probably not return to school unless there's very little or no community transmission. Also, reducing risk wherever possible, so keeping surfaces cleaned, keeping people physically distanced, all of those measures. The virus ideally will not be brought into schools in the first place if there's very good screening, but we also have talked about the asymptomatic infection and transmission. So even screening will not be perfect, but screening is certainly essential. Before you send your kid to school, make sure you check their temperature and make sure that they don't have any other symptoms that could potentially indicate infection, even early symptoms such as a runny nose or sore throat. Schools are also looking at reducing occupancy, especially in an indoor setting, so they're not having as many children in the same physical space as they would have been able to have last school year at this time. They're reducing mixing among students and staff, so they're trying to keep students in groups where they're only with that group to the extent possible. That would actually help a lot with reducing how many people might be exposed to an infected person, and then if there are people exposed, being able to track exactly who they are and monitor and follow them. Students, teachers, and staff will all have to wear masks. That's going to be really important. And there will just be new health and safety protocols, increased hand washing, increased awareness, signage, those are all going to be done in preparation for if they do get a case, and then if they do get a case, they have protocols working with the school nurse on exactly how to handle that and what will be done once someone maybe who's ill is identified or someone who's not ill but tests positive. There are plans in place for all of that. There will be variation between school districts. They have different physical setups, they have different staffing, different capacities, so there's not a one-size-fits-all approach, but those are the basic principles that schools will be following.
What states, you indicated that you don't recommend travel, what states would that be including?
So I don't have the list of states off the top of my head. At this point, there are well over 30, but you could go to a state that's not on the list today, and it may spike high enough to be added to the list tomorrow. So regardless, when you come back, you're going to have to be quarantined. I am not able to predict that. Just because the state's not on there right now doesn't mean they won't be shortly. So my recommendation as a blanket statement would just be to continue to avoid travel at this time. That's the safest option.
What are your thoughts on travel in New England or within New York State?
It depends on the location in New York State. In our county right now, fortunately, because of all of your hard work and all of the county's hard work, our rates are not as high as they are in other areas, but there's really nowhere that I would consider safe right now.
How reliable are the tests? What percentage of false positives is out there?
That varies a lot by the test. There was an approximation early on that they're about 70% reliable, with about 30% being false negatives. But again, testing has evolved. There are a lot more locations that are doing testing, a lot more laboratories that are testing, and a lot of different types of tests, especially the antigen rapid tests. So that would have to be looked at based on the actual test that's being offered.
How many people are currently hospitalized?
I actually don't have the numbers for today. I don't believe any are hospitalized at the moment, but again, that changes throughout the day.
Do you know when jobs will open back up?
Well, jobs are opening by what industries are allowed to open, so again, that's determined at the state level, and it varies based on the type of job.
Those are all of the questions that we have received at this time. So we will go ahead and wrap up if there's anything you would like to finish with.
Just again, thank you all for doing everything that you've been doing. Keep up the good work. It makes a difference. I'm really proud of our local numbers, and we're going to continue to work to keep this contained.